Okay, hello. My name is Peter Sawyer. I'm a dermatologist and the chair in dermatology at the University of Queensland in Brisbane, Australia. And it is now my great pleasure to chair this discussion. We have just heard these fantastic talks, and I think we start. Sam, you just gave your talk, and thank you so much. And obviously, all these new regulations which you have mentioned, I think they will inevitably increase the costs and slow down the completion of data collection, and probably even discourage participation by clinician investigators who often already are drowning in paperwork. And the question is, are the days of exploratory investigator-initiated studies of new toys over? What are your answer to this question?
No, look, I think the days of exploratory analyses and new toys and investigator-initiated studies are certainly not over. I think that the purpose has probably been the thing that has shifted. Now that these, and we're talking specifically here about software as a medical device product, so we're not talking about products that or software that's not got a medical purpose. So we're definitely talking about something that has a diagnostic function, something like an app that's AI driven for skin cancer diagnostics. Those sorts of products now need to be treated differently when it comes to clinical trials. If that trial, for instance, or that study is going to be used for regulatory purposes. If it's an academic study, if it's purely an academic research question, proof of concept study perhaps, then investigator-initiated studies as we know them are perfectly acceptable and really valuable. So the time and cost of resources in that space, in the academic research space, won't change so much. What will change is...
Yeah, please go ahead.
What will change is the commercially sponsored trials. That's really where you'll see an increase in cost because of governance oversight. Data management has to be tighter. It's just more rigorous. So it's really a subset of studies that will increase in cost and time, but it certainly shouldn't be something that should deter our investigators from participating because the resources are there to support them.
Look, if I can, thank you so much. If I just can now, I have basically a follow-up question. Obviously, regulatory reforms, it seems that they are coming, and I'd like to ask you, and then maybe Akash can also kick in, what's the nature of these reforms and what are the driving forces behind them? Is this basically the industry, or is this academia, or is this regulatory bodies like the WHO or the individual agencies?
A great question, because where are all these reforms coming from? It really speaks to why they're coming. And they're afoot across the globe. We're talking about all major regulatory jurisdictions, such as the FDA, the EU under the medical device regulations, Australia and New Zealand with the TGA reforms. Look, what might come as a surprise to many of us is that until recently, many of these software-based products with a medical purpose weren't subject to regulatory review prior to being commercially available. So what that means for the dermatology community is that we've had no way to know whether a software-based product that offers, say, a diagnostic function for skin cancer detection is actually safe and effective for the use that it's intended for. So before the regulations changed, diagnostic apps and other software applications didn't have to prove to regulators, or anyone for that matter, whether the false negative rates were acceptably low, that the machine wasn't a send everything to biopsy machine in an effort not to miss a malignancy. So that performance metric wasn't there. And look, both eventualities have impacts for patients, for our healthcare systems, So I think as a collective, patient concern, regulator concern, clinician concern, healthcare policymaker concern has brought about enough collective concern to prompt regulatory changes. So the nature of the change is really that now manufacturers, and that's, when we say manufacturers, we say software developers as well are now manufacturers, just need to provide regulators reasonable assurance that the products are safe and effective.
Okay, so but thank you so much, Sam. But can I now immediately jump to Akash, because you spoke about global governance of telemedicine, right? And AI for skin diseases. Are you happy with the answer which has been provided by Sam?
I think the answer was extremely accurate, especially how she began the answer. The regulatory concerns have started and center around why we need regulation. And in the past, often regulation has been internal. If there is a private sector organization, a private sector body that has created a tool, they have internal regulatory processes. We do not have something common for all tools, especially on the global level. And this comes down to how much need there is, how much governments have lobbied for it at the WHO level, when we're talking about the WHO and the UN and the global governance framework. But I think the bottom line is that there is absolutely still a great need for common regulation, for situationally relevant regulation, primarily because tools are different in different countries. Different tools work in different approaches. They mean different things to different people of different ethnicities, of different geographical origins. The positive of global governance, the positive opportunities for global governance is to unite these different stakeholders and bring together an umbrella body, an umbrella regulatory framework that can then be adapted to different contexts.
Oh, thank you so much, Akash. And hearing now your answer, it comes something to my mind, which I'm actually, I and particularly Liam, we are quite interested that this is basically a I like to, and you mentioned also different ethnicities, different cultures, and so on. So I would like to hear your thoughts, Akash, but then I like also to comment, Liam, on this. What are your thoughts, Akash, about the privacy framework for total body photography, which obviously is crucial for telemedicine in dermatology?
At the moment, there are very little privacy frameworks that exist on a global level, at least. There are thoughts, there are processes that bring together the need for a global governance framework. For instance, now WHO is bringing together a health data governance framework. Part of the health data governance framework will focus on what telemedicine brings to the table, what solutions and what the intricacies of telemedicine are. Once the framework comes into play, which is still a couple of years away at most, we will then have to understand the global intricacies of telemedicine, in that what happens cross-border, what happens to data that is collected from one country, and who owns this data. So if there is a telemedicine agreement between, for instance, Mali and Afghanistan, with doctors from Mali, and data from Afghanistan, who owns this data? Is it the country that owns the data? Is it a patient in Afghanistan that owns the data? Is it the clinician in Mali that owns the data? So there are a lot of concerns around this even today, and regulatory frameworks must bring in addition to just privacy, there also the ownership aspect. And these are questions still unanswered, and hopefully we will soon answer.
Okay, so thank you so much. And can I just now ask Liam, what are your thoughts about privacy framework in dermatology and how to address this? I mean, Akash made it very clear that for different countries, for different nations, it's probably, yeah, there are different cultures and the different approaches. And I'd just like to hear your thoughts, Liam, to this topic.
Look, I very much agree with what Kesh said there, that the existing privacy frameworks do not support dermatology well. Dermatology is not unique, but we have this situation where say in radiology, we were able to de-identify or anonymise images, largely based on the demographics that were associated with those images. But with dermatology and a number of the other medical imaging producing specialties, the images remain visually identifiable. In addition to that, they're sensitive and they're potentially unflattering images, particularly with total body photography. So we need to look at specific privacy frameworks. They're not completely reinventing frameworks for privacy, but just adding controls to support those things. I think it's all about risk-based assessment. Now, we need, the face to be visible for some of our AI algorithms to work, so we can't completely obscure the face. So it's about looking at how sensitive the data is, this risk assessment, and then putting in adequate controls based on the risk assessment.
So thank you, Liam. Obviously, quite a bit of more work needs to be done in this context. But Akash, can I come back to you with maybe a little bit a heretic question? Who is in charge now, and who do you think should be in charge of a global governance of dermatology AI in the future?
This is a very difficult question to answer, in that it's difficult to give a direct answer to this. At the moment, different countries seem to be in charge of the tools that exist in their countries. There is a movement towards WHO taking more ownership in this regard. If in the next 5 or 6 years, we end up seeing a global health data governance framework out of WHO that speaks about telemedicine, then we move in that direction, which seems to be the direction we're moving in, but that is still many years away. And technology evolves much faster than the systemic process that comes when we're trying to get a global governance framework. So ideally, very ideally, from an ethical standpoint, it should be a neutral and trusted platform that WHO has demonstrated in certain ways in the past to be one. If that is not feasible in the next 5 or 10 years, we still need a platform where different countries can come together, different clinicians from different regions of the world can come together and share lessons, cross-learn, and bring together different lessons from their own jurisdictions. Ideally, it is WHO's responsibility. In the past, governments have put the responsibility on WHO. From an ethical standpoint, that would be my position.
Okay, so thank you so much. And actually, to be honest, I personally feel the same, right? I mean, this is, as I see it, a role which the WHO has to fulfill, and this is how I also feel about it. Can I just go back now a moment to you, Liam, and basically let's go a little bit more there's a question from Amanda, actually, Professor Oakley. She asked, DICOM is cumbersome to apply to dermatology images taken in busy clinics by busy clinicians. At least this is how she phrases the question. And it has been a problem, a big headache to persuade clinicians even to take proper consent prior to imaging. Yeah. So I guess she is very much interested how this input of data described in your results is required for AI purposes, and how much of this process can be done automatically.
Yeah. Peter, thank you for the question. Whenever I talk about DICOM, the response from at least somebody in the audience is that it's cumbersome, it adds a layer of complexity, it adds a layer of cost, it's not appropriate for dermatology, it's only appropriate for radiology where they have high cost equipment. Now, these statements are unfounded, and the statement that it adds, it makes it more cumbersome is not accurate either. Peter, a point in case is that you've got a total body photography unit in your department, which has recently had a software upgrade. It is now DICOM compliant. Now, there's been absolutely no change from the melanographer's point of view how they do the imaging. There's no increase in the time to do the study. There's absolutely no change from their perspective. because these underlying protocols are built in, and the efficiency of imaging is based on the user interface rather than the underlying protocols. Apart from a number of things, is that DICOM is now afforded such things as the melanographer now no longer has to manually enter the patient demographics. They can use a DICOM modality work list. So in fact, it's not cumbersome. It actually improves the workflow. And then, there's I take interest in a number of comments about the lack of availability of reports for biopsy. And I think this is a symptom of the lack of standards, the inability to share information, rather than a problem caused by standards. So what the problem is highlights the fact that standards aren't well used in dermatology, and using standards will actually address some of these interoperabilities and this information sharing issues that have been alluded to in the question. I will just add very quickly, Peter, that standards do promote automation. In a previous job, I was, administrator of a large PACS system, and given that the metadata was actually included with the images, it allowed us to create a huge amount of automation rules. For example, all images that were required for external hospitals could automatically be routed, and it's similar that these standards, when you've got every actor in the digital health ecosystem talking the same language, the same standard language, it facilitates, rules and automation. So they are very correct in saying that standards promote automation of these tasks, particularly in the AI workflows.
Okay, so thank you so much for clarifying this. When I hear you talking, I think this talk, what you are saying now, shouldn't just be given to the converted, to the people who are interested in telemedicine and AI. This is basically information which should be given to the cold-faced dermatologist. But I have then just a short follow-up question. You have probably heard me saying it several instances, Liam, that I was saying that dermatology is 30 years behind standardization and how we do the workflow and everything what is to do with imaging related to radiology, right? So we are certainly behind it. The question which I have now is, how many years you think it will take till dermatology is on a decent, modern, state-of-the-art standard in regards to to standardization of imaging processes?
Yeah, Peter, that'll be incremental, and there's certainly a number of factors that are driving it. The move away from using commercial off-the-shelf digital cameras or smartphones to acquire clinical images to things such as advanced imaging, total body photography and optical coherence tomography and reflectance confocal microscopy. That's driving it. The fact that sequential digital dermoscopy, where we actually need to actually store and review images in a sequence, that's going to drive the adoption. So the adoption is going to be small. Actually, I will add one more thing there, Peter, is AI is going to be a big driver of standardization. I agree 100% with your statement that dermatology is behind the technology curve compared to other medical imaging specialties. The good thing is that it doesn't have to go through the same learnings. That it can leverage the learnings from these other specialties, such as cardiology and radiology. So, we'll see this incremental change over the next number of years, and there's already a number of very strong drivers and exemplars of use of DICOM in dermatology workflows.
Okay, so I have now another question is coming in from, thank you, Liam. Another question is coming in from Amanda, and this question is for you, Monica. And she says, and she asks, do you think the finding for some smart behavior improvements using frequent interactive text messages can be applied to other behaviors? And she thinks of two situations: attending clinical appointments, because we have about, she says, it's 15 to 20% non-attendance in the public system, and I think this is absolutely true also in our experience. And then the second situation is getting regular blood tests done to monitor treatments. Every so often patients are coming and say, oh, doc, I have unfortunately forgotten to do my blood test. I will bring it the next time. So can you comment on these smart behavior improvements?
I'll try to. My internet is a little bit slow, so sorry if I drop out. Yes, definitely. I think we can use this text messaging intervention for a number of behaviors. It doesn't have to be just some smart behaviors. It could be any other behaviors as well. So I would definitely encourage clinicians to try to use it in that way, as Amanda stated, to improve attendance at appointments and to improve blood test receipt, definitely.
So
it's
if
just
I
a matter
just
of,
can, yeah, please.
It's just a matter of using those behavioral intervention techniques that we used in our study, which are personalizing interactivities, so making the text messaging really a conversation. And so the systems that many practices are now using to remind people about their appointment. Sorry, yes. So the systems many clinics are the systems that many clinics are using for reminding people about appointments could also be used for that purpose. Sorry about the internet.
Yeah, no worries, Monica. So I mean, quite a few of these reminder systems in regard to clinical appointments in the private world, they are already integrated in many clinical practice. And I wonder, have you heard that this preventive program is already implemented in some, let's say, state-of-the-art dermatology clinics? Have you heard about this?
No, actually, I haven't. So that would be really interesting to find out. I don't think so.
Okay, yes, it is also not to the. This is also, to the best of my knowledge, not available. And then it seems that the program, what you have shown, has had great success for sunburn, but this was measured just by self-report. And I can imagine this could be replicated probably by more objective measures in the future, sending in a selfie or things like this. Have you thought about this?
Exactly, that would be wonderful if we could use images of the skin tone, for example, and objectively assess whether the skin reminds.
Okay, I think you have been broken up, but it's. I understand that you think that this would be a very good idea,
Yeah.
Monica. Can I just ask our panelists, Sam, Akash, or Liam, do one of you have a questions? Would you like to ask one of the colleagues here?
Yes, I would like to ask Sam a question, if possible.
Yeah, please.
So, Sam, how will you inform people about the new legislation? Because not everyone might be aware of it. So is there an education program wrapped around it, or how do you actually get the information out?
It's a hard thing, Monica, and I think what you've raised is really important, is that clinicians, patients, if you're not in the regulatory space, you're not to know that these changes are happening underneath your feet and around you. So it's actually upon the manufacturers of software-based products to let you know that that maybe their regulatory status has changed. I think what would be really helpful, and I have no answers as to how to get this information out there, but to have a short, here's how to spot a medical device, a regulated software medical device from 50 paces. Because if you read the regulations, they're exceptionally clear. The FDA guidance documents are great. The IMDRF, which is the International Medical Device Regulators Forum, what is defining a regulated software is clear and concise. But if you don't know it's there, you don't know to go looking for it. So it's a great point you raised. How do we get the message out there? first point of call to clinicians. If you suspect that you're using a piece of software in your clinical workflow that seems to perform a medical purpose, is it diagnostic, is it for monitoring, is it for prediction? That's a hot tip for you to say, I might actually contact the manufacturer of this product and say, hey, tell me about it. Are you regulated? If not, fine. But if you are, tell me about your status and the data that you've got to show me that this thing actually works and is safe.
So Sam, that leads to a very good point there, that you're talking about now, and probably this regulatory framework around AI in dermatology and in other medical specialties, that we're saying that you're going to have much closer relationships between vendors, researchers, and the regulatory bodies. Is that the way you see it as well?
Absolutely, collaboration is key here, and this is, I think, an important point, that that investigators that are used to working in a purely academic environment, investigator-initiated studies in that world, don't necessarily have. It's not mainstream to have those relationships with industry, with commercial partners, and to be dealing with the regulators to get the trials registered or to have to do safety reporting. So it's a new world. It's an awesome world because we can do great things, but we do need to all work together across clinical investigators, manufacturers, regulators. We all need to pull together on this and be really transparent.
Yeah, and perhaps to some extent, the world of informatics, health informatics, went through this journey, some time ago. And it spawned this applied informatics research, that looked at actually, implementing and translating research. Do you think we're going to see an applied AI or applied regulatory research disciplines emerge from this?
Look, I would love to say yes, but it's also new. The regulation of software as a medical device, SAMD products, it's new for regulators, it's new for the industry, it's new for software developers that have not worked in a regulated medical device space before to come into this world. So the regulations are as new that the medical device regulations, MDR, came into effect in Europe only last year. They were delayed because of COVID. Then we had only the TGA launching their SAMD regulations earlier this year. So if we can bring our AI developers that have come from either academic backgrounds or IT backgrounds, pure mathematics backgrounds, into this regulated world of healthcare and medical device development, we'll be doing really well, and we may see the advent of a new niche, a new specialty role, because it's complex, and if we can get the programmers upskilled and get good software documentation processes as just part of life, then the transition into a regulated space should be relatively easy. But it's a challenge. It's all new.
Oh, for sure, Sam. I agree that it won't be without its challenges. Thank you.
So if I like to reiterate it, basically to summarize, actually, I like the idea of an applied AI research a lot. And I think there is also really the need of a close collaboration of industry on one hand, of the regulatory agencies on the others, and not to forget the domain experts, which in our case are the dermatologists. Right, so this is really a need to a real multimodal process, and I like also to take the opportunity to thank you all for the discussion. But before we end, I would like to Akash to say you a kind of a final statement, also giving your role with the WHO, because I really think it's so important to have a global oversight body. Akash, please.
Thank you, Dr. Sawyer. We are unquestionably in the midst of a technology revolution. As the speakers, as all 4 or 5 speakers have mentioned over the last 30 minutes, technologies have evolved over the last 30, 20 years and will continue to evolve for skin disease prevention and treatment, and also with the wider global health community. and they offer unprecedented opportunities to reach health outcomes. But in addition, in complementary to the opportunities, they come fraught with risks. They come fraught with ethical risks, with technological risks, with human rights risks. It's very, very crucial now. It's extremely important for us to unite with our different disciplines to come together and ensure an equitable and inclusive global health governance future that brings together strong regulation of different medical devices, of artificial intelligence, of medical technologies, and ensure that we use this for global public good.
So, thank you, Akash, for this beautiful final statement. And in this spirit, thank you so much, and thank you all for the great discussion. Cheers.
Thanks, Peter.
Pleasure. Thanks, Peter.